Hello, everyone. Today we are continuing the roadmap to becoming a doctor. Today we are specifically talking about the transition to residency. This is where you train for your specialization, whether that is internal medicine, whether that is general surgery, plastic surgery, neurology, obstetrics and gynecology, urology, and so many other specialties within residency. Residency can last anywhere from 3 years all the way up to 7 years if you are doing, for example, neurosurgery. So it really depends on the specialty, how long you will have to train in the United States. Residency is the time when people immerse themselves in clinical training. This is when you go from being a medical student to being a doctor for a first time. You take on increasing responsibility in patient care. Obviously, you will have to handle your own patients. Sometimes you might have to handle 4 patients, five, six, seven, eight. It really depends on where you are training and what you are training in. But you will always have supervision from a fully trained doctor who will be there to teach you and make sure that obviously you're providing the best patient care possible. This is also a time to develop critical thinking and decision making skills so that you can start becoming more confident and work towards practicing independently as a doctor and taking care of patients, especially by the time you graduate from residency. You are going to work towards mastering specialty specific knowledge and skills. During medical school, the goal is for you to learn a little bit of everything. And here, the goal is for you to dig deeper into a specific specialty area. You want to really gain as much expertise in your chosen specialty through hands on experience, reviewing current guidelines, conducting research, and understanding the best practices in that particular field. Whether you want to work towards becoming a cardiologist or a gastroenterologist or a surgeon, this is a great time to really hone in on your specialty. In addition, you want to build strong relationships with attending physicians and your peers. These professional relationships are great for mentorship, networking, and helping you towards your future goals. And remember that medicine is a team-based practice. You have to work in teams, whether you're working with other doctors, nurses, respiratory therapists. You really need to learn from each of your colleagues and realize that medicine is a multidisciplinary sport. Additionally, this is a time where you will have to continue developing your time management skills, efficiency. You will be taking on more and more patients as you progress in your training. You will have higher patient loads while still trying to maintain the same quality of good care for your patients. So you will have to become very good at prioritizing tasks and practicing efficient charting and documentation. These are the administrative tasks that most people really dread, but pre-charting on your patients and documentation is a requirement of the job. And during residency, you can also choose to continue engaging in research and quality improvement. You can participate in research projects that are specific to your specialty, quality improvement initiatives that help the hospital system work better, and overall trying to contribute to advancements in patient care and demonstrating a commitment to your field, especially if you want to pursue further subspecialization after residency. This will help to create a very competitive application when you go into fellowship. You will continue to cultivate strong communication skills. You will obviously have to effectively communicate with your patients and make sure that you are expressing empathy and have really good bedside manner. You will have to practice delivering difficult news and supporting patients' families, but you will also have to have good communication skills with your colleagues. So don't take these soft skills for granted. They are extremely important in medicine and the outcome of care for your patients. But in order to take care of other patients, you must also prioritize self care and wellness. There is going to be a lot of stressors, both personal and professional, during residency. So you really want to figure out ways how to best manage your stress, whether you want to take care in self care practices, and how you plan to establish work life balance. It is great to have a support system nearby, whether that's from peers, friends, mentors, or even professionals like therapy or psychiatry. But you have to really focus on putting in the effort to take care of yourself so that you do not burn out and can then continue providing high quality care to your patients. Lastly, during residency, you will have to take more exams. The MCAT or the Step 1 and Step 2, which we talked about for college and medical school, are not the last exams. During the beginning years of residency, you have to take the Step 3 exam, and then as you graduate and become a fully certified physician, you will have to take board examinations. So knowing how to create a study plan, how to regularly review for your board exams, how to do practice questions while you are also working full-time or taking review courses and practice exams, all of these things are very important. So learning how to have these really good study habits early on is good for your overall career, because board exams, you have to get recertified. Even when you are a physician, you have to get recertified after a certain amount of time. So these exams continue. It's not like you just take one and then you're done with the rest of your life. You have to be a lifelong learner in medicine. And towards the later years of your residency, you will start planning for your career. You really want to reflect on your career goals and whether you want to maybe pursue a fellowship training and become a cardiologist after internal medicine, or maybe you just want to look at different job opportunities and consider applying for a job directly after residency. But once again, all of the things we've talked about when you apply to college or medical school, you still have to apply, whether it's a job or fellowship. You will have to have a very solid CV or resume. It is a great idea to connect with mentors who can provide you with feedback and help improve your applications, and really start networking for future roles. Medicine and the subspecialties of medicine tend to be very small networks of people, and having connections and friends in those areas will always be helpful to you. Thanks for tuning in, everyone. This was the overview of what residency might look like. We invite you to join us for Premed Academy, where we help pre-med students get into their dream med schools through low-cost education, interactive courses, access to experienced mentors, and an awesome supportive community. If you're interested, check out the link in the description.